what is this? You got to know. You got to know for step one. You got to know. It is Tocilizumab. It is an anti-IL-6 receptor monoclonal antibody that's indicated for giant cell arteritis, and it's in cytokine release syndrome. So what does it do? It binds the IL-6 receptor, and it prevents the IL-6 from binding. And it also antagonizes IL-6R on the liver, reducing the amount of the acute phase reactant. Because remember, hot, T-bone, steak, EAK. K is acute phase, right? That's a really good acronym to remember. A couple of other videos on that. Cytokine release syndrome is seen in patients who are treated with rituximab, as people like to call it, due to the generation of the cytokine storm. And so yeah, let's just talk about this really quickly. Tocilizumab is a monoclonal antibody. Before we dive into this question, it blocks that receptor, right? The IL-6. And it's going to be a pro-inflammatory cytokine, IL-6 is. And it tells the liver to make acute phase reactants like CRP, fibrinogen, and serum amyloid A. And so the proteins will go up in inflammation. And Tocilizumab will inhibit IL-6R and decrease the inflammation. So it's used for giant cell arteritis. That's the inflammation of the temporal artery. When you see the veins popping over here, just like kind of looks like comment below the villain's name, Angstrom. Never mind. Dang it. Somebody comment that and like that. I don't know. Who cares? It's from Invincible. Yeah, it's super good. But anyways, giant cell arteritis. Also cytokine release syndrome that happens after CAR T cell therapy. And so the body releases tons of cytokines, causing the fever and low blood pressure and organ dysfunction, and Tocilizumab helps with that storm. So that's when you use it. 68-year-old woman, new onset, and she's given this that targets this receptor. What's the best mechanism for the medication? So it's going to block the IL receptor, so it's going to bind and inactivate it. Actually, no, wait, that would be, it binds to the receptors. That's tricky, not IL-6 itself. So this is actually a really good trap answer here. Yeah, not IL-6 itself. So it binds to the receptor. Oh, they're sneaky. IL-1 blocks IL-1 receptor and reduces. That would be anakinra. That's not Tocilizumab. So it has nothing to do with IL-1. No, don't need to know about that one. It inhibits the receptor. There it is. Ding, 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 ding. We have a correct answer. And they're being tricky with it. Is the receptor or is it the IL-6 itself? So yeah, it decreases the acute phase reactant. That's the correct answer. D, inhibits TNF alpha. That would be like your infliximab and adalimumab, and yeah, not going to be that one. So INF alpha, that's not related at all to IL-6, so not going to be it. Anyways, that's pretty much all there is to say about this wonder drug. And yeah, cytokine release syndrome, calm the immune system, protect your vision in giant cell arteritis. And yeah, that's all we got. So we'll see you in the next video. Like and subscribe. We're trying to get to 100 subscribers.